kabisa, na kitambulisho ndicho hicho. Sebule ama ukipenda kwa lugha ya kimombo the lounge, mahali ambapo huwa tunakuletea wageni ambao ni experts katika masuala tofauti tofauti ambayo tunaongelelea, na kama ni Monday bado huwa tunakuletea wasanii ambao ni experts katika mambo ambayo tunaongelelea, na kama ni siku ya Tuesday tunakuletea wanasiasa, wanabiashara ambao ni experts katika vitu ambavyo tunaongelea. Katika lounge ama set ya leo nimekuambia watu ambao wa kwanza tuko na wao ni Sauti, Zetu Hub. Good morning Mercy, good morning Mary. Mkoaje? Karibuni sana katika KUTV Rise Today siku ya leo. Napata tabasamu tena zaidi ya kwamba tuna wanaume wengi sana. Sasa hata kama tunataka kuongelea tuambie basi hii serikali we are looking for two thirds nyinyi mko hapo mko tu na mimi ndio third. Si inaingiana? Iko fiti. Sasa kwanza nawapa nafasi muwasalimie watazamaji wa KUTV, muelezee kwa undani nyinyi ni nani, alafu muwakaribishe katika hii conversation ambayo tutakuwa tukiongea kuhusu sexual reproductive health and rights. Rights wanafaa waeke in bold, si ndio? Mary, tusalimie.
Asante. Okay, my name is Maina. Mimi sexual and reproductive health advocate and a member at Community Voices and a Sauti Zetu Hub. So I lead a project which is called We Speak under Community Voices, and We Speak mainly focuses on how we can use media advocacy to amplify SRH, which is sexual reproductive health. So we focus on targeting different media centers like TV stations and radios. We do Twitter chats and TikTok videos to amplify the sexual and reproductive health initiative. And mainly we seek to reduce teenage pregnancy and GBV and prevent infections of HIV and AIDS.
Mary Maina. Yes. Kazi safi tena zaidi. We Speak, tutakuwa tukiongelea kuhusu hiyo project pia under Community Voices. Mercy, azuna tusalimia, tukujue na utukaribishe zaidi. Tuambie pia kuhusu tofauti kati ya Community Voices and Sauti Zetu Hub. Je, ukubwa wa Community Voices, how big is it? Sauti Zetu Hub, what's the relationship between the two? Karibu.
Thank you. My name is Mugecha, and I'm so happy to be here to have this conversation. And I welcome all of us to this amazing conversation. So yeah, I'm Mugecha. I'm a student here at Kenyatta University. I do gender and development studies. I'm also an SRHR youth advocate, as she mentioned. Sexual reproductive health and rights is a very urgent thing that we as young people are supposed to be speaking and advocating. But unfortunately, due to the stigma that surrounds it or the fear, not most people know about it. And that is why we, as Community Voices or Sauti Zetu, are here to amplify these things. That is why we do media advocacy, because we understand that young people, and mostly our targets, where we can find them more easily is online. Is in TV, the Twitter, the TikTok. We also do TikTok lives and all that.
It's called leveraging on that digital platform
to
ensure that you reach all of them. I think you guys are a little bit advantaged when it comes to discussing sexual health and reproductive and those rights, because I think when we were growing up ourselves, we found our parents who you could only speak about issues to do with sexual reproductive health when they start seeing wewe ni kama umeanza kwenda nini ndo yako haingi, and they would tell you like we Mary chunga hawa vijana. So kama mimi niligrow nikichunga wasichana, kwa sababu wasichana tulikuwa tunaambiwa ni watu wabaya, wasichana wanaweza kuharibu, lakini hatuambiwi vipi kama wasichana wanaharibu. Why do we have a mother and a father in this home? Mulipatana aje kama mnaharibiana? Why not us? So I'm glad seeing that youths have stood up to amplify voices on these issues, and they talk about them themselves. Sindio? Hilo ni jambo ambalo ni la busara sana. Community Voices, mkona watu kutoka upande gani? Is it a Korogosho thing ama you going everywhere, Mary?
We have members from different areas. We have members from Korokocho, Mathare, Isili, and Kariobangi in large. But we've mainly focused on informal settlements because young people from the informal settlement are most underprivileged. So I think that has been our main focus area, and we do areas on livelihood, health, and education. So we make sure these young people are able to access sexual and reproductive health services. They're able to go on with their education, and then we uplift their livelihood in different ways.
So you've started from the bottom.
Yeah.
Literally.
Yeah. On the same, if I may add something, Community Voices has been in existence for like 5 years, but we did register it just the other year. And Community Voices and Sauti Zetu, Community Voices is the name. Then Sauti Zetu is a hub that hubs young people.
Okay.
So it is no difference where it's one and the same. In Community Voices in Swahili is Sauti. And now we're saying it is Sauti Zetu sasa.
Really? Because
exactly.
we are the community at the end of it all. So at that community level of conversation, there has been a notion or a perspective. Those people who live in informal settlements, what in Kenya we call ghettos, have refused to be digitally aware. Now we have to go to them, speak to them, so that they can speak to others. Ndio haya mambo yatake kukaa ni ya kibombe. Ati unajua Afrika mtu akianza kuwa na mambo ambayo yanasumbua akili, the mental health issues, wanasema huyu ni mwenda wazimu. Lakini kule majuu wanasema this is just mental health. We can tackle it. Sindio?
Sure.
Now you guys coming up and saying no, as Gen Zs we have to do something. It is possible and it can be done. What are the main topics apart from talking about education and livelihood in the hub, Sauti Zetu hub? What do you really tell these people? What do you really train them when you're talking about sexual reproductive health and rights?
So sexual reproductive health and rights is a broad thing. So we have aspects of, like you mentioned, mental health. We have aspects of antenatal and postnatal care. We have aspects of HIV and AIDS, STIs, transmission and infections. We have stories of, let me mention maybe safe sex, which is now the bigger thing inside sexual and reproductive health. So mostly we advocate for prevention of HIV and AIDS. You've heard about the triple threat. The triple threat mainly focuses on prevention of HIV and AIDS, reducing cases of GBV, and teenage pregnancies. Because when poverty, people from the informal settlement are mostly affected by poverty, and poverty is a key contributor to issues like early teenage pregnancies. When one does transactional sex, it's also a key contributing issue to issues of HIV transmission, because you are not able to afford commodities to prevent yourself. Because when I'm in the ghetto, I have to like balance between if either I want to buy a packet of unga or a packet of condom. So there's an issue there of maybe accessing commodities. Yeah.
The level of poverty is greatly influencing priorities.
Yeah.
Such that you would choose to throw away caution so that you can eat or to survive.
Yeah.
Mercy, as a young person, what are some of the challenges people of your age are going through when it comes to matters of sexual reproductive health and rights that we have to talk about?
Well, thank you. As she mentioned, SRHR is not about sex. It's not about ngono. It's not about sex and everything. There's a lot of things that comes when we're talking about SRHR, and there are very many challenges that we as adolescents and also young people face. Number one challenge that I'll mention is the lack of adequate services. if as a young person I want to get services on SRHR. For example, I just want to I want to go to our nearest health center and get contraceptives. It will be very difficult on me because the persons that serve these health centers, they're people that are well known to me, and because I'm a young person, I don't want them to know that I want to seek these contraceptive services. The places that we go to are not youth friendly. That is why we are creating hubs that are youth friendly, that any young person can come, can enter, can express themselves in a way that is comfortable to them. So we have problems of service delivery. Our hospitals are not equipped fully to cater for our needs as young people. Then also we have this personnel that we find in the hospitals. I don't know if they're not well trained, but they're very hostile. For example, there's this media things that it's like a skit that young people see online, that umeenda kutafuta matibabu kwa sababu uko na STI. The doctor will call you out. He'll maybe shout your name, wewe mwenye uko na STI, and it is
wakisonono
kuja wakisonono aya kaswanda ni wewe kuja, like they're not safe. And that is another challenge that makes it very hard for young people to access these services. Then also another thing is that we still have this discrimination or stigma when for these people that maybe are HIV positive. The community still has not maybe embraced them. There's still that stigma in as much as we don't talk about it. When a teen girl gets pregnant, it is very hard for them to go back to school, and mostly in our informal settlements, when a young girl maybe 17 or 18 or even 15 amepata mimba, kurudi shule itakuwa ngumu sana. We don't have clear policies that speak to going back to school. Yes, we are told that education is a fundamental human right that every child should get, but things kwa ground need different. We still have very young mothers who still want to pursue education, but still they cannot do this because there's life balance, they need school. There's a lot of mental health issues. If for example, nilienda nikapata nikakuwa at a disadvantage ya kupata maybe gender-based violence, for example, or sexual gender-based violence, and it is something that is there. Actually, KDHS report says that in the 15 to 49 girls in that age group actually suffer, like 49% of them have experienced gender-based violence in their life.
In a way. It is in many forms. So these are forms they've experienced.
Yeah.
Not necessarily rape, not necessarily intimidation.
Sure.
But it has been so hard for them. Mary, back to you. Utapata sasa kitambo, there used to be the notion that ukipata mtu kwanza wenye wako na hali ya HIV, that wamerogwa, lazima kuna mtu kwao ni mchawi, unaona. Now atatoka huko kwa hii conversation ya community sexual reproductive health and rights. Utapata bado kuna watoto wenye wako chini ya umri wa miaka 18 wameshabeba mimba, na wengine wako na watoto. They still need their lives to be normal, ndo waweze kusoma kwa wale ambao hawajasoma, ndo waweze kufanya biashara kwa wale ambao hawajafanya biashara, lakini sio hao wenye ni watoto. The conversation ya family planning at Sauti Zetu Hub, huwa mnaianzisha at what age and what should inform this decision ya kusema at this point let's start teaching our young men and women about sexual reproductive health and the rights. Nini uinform hiyo decision? Na ikishafika hapo hivyo, baadhi ya changamoto ambazo hawa watu ambao wana seek family planning wanapata ni gani? Cause sitakudanganya, I've been in a situation whereby you are in a community hospital. Na ukiwa hapo hivyo, unapata wauguzi fulani, mostly mbona ni nurses upo, kwa hiyo wauguzi fulani wako pale hivyo, mtoto mdogo kwa nini unajihusisha na mambo ya ngono? Sa hiyo it already happened. What is the right age to start the family planning conversation, and how should we help these people in community to access these services when they need them. Kuna wengine mpaka wako 17. It's true, they have no consent in anything, but it's their lives. Ni yeye amepata ball saa hiyo. What should we do?
I would say that sexual reproductive health is packaged differently according to your age. So we have age-appropriate comprehensive sexual education for everyone. I'll give an example of a 2-year-old. If you have a 2-year-old, or if there's a parent out there with a 2-year-old, they'll mention to their child about their reproductive health in a simple way, like, usikubali mtu ashike dudu yako, usikubali anko kushike huku nyuma kwa matako. That is already a sexual reproductive health education. I do not need to go and give that 2-year-old a condom. He or she does not relate to that. So when we go back to schools, we can teach on abstinence for people who are in primary level. But for young people who are sexually active, we have to refer them for counseling and also get appropriate information from healthcare workers, because information is everywhere. There's all type of information in the media, back at home, wale aunties were ground. Everyone has information, but the correct information can only be found in specific areas. That is where Sauti Zetu comes in. So the hub is mostly a safe space and an information center. When you are in the hub, you can get information to differentiate myths and misconceptions from the community and what is relevant. So when it is a safe space, we encourage young people to come and talk out issues they cannot talk at home. I'll mention the issue of you cannot talk to your parent about sexual reproductive health. Where would you start from? You would come to Sauti Zetu Hub and find someone who can relate to you and talk to you about them. The issue why we can't talk to our parents, we have different issues. One, we have irresponsive parents. They're there, but they're not there. They feel like once they've provided food, once they've provided education and shelter, that is enough for you.
The rest is food.
That is enough for you. So we have parents who are also do not have work. They have to go for a long period of time, so there's no connection between the parent and the child. Then we have parents who are drug abusers. You wouldn't expect to get information from somebody who is abusing drugs because the information will be distorted somehow. So that is where community voices comes in. I, as a young person, would in one way pass information on sexual reproductive health to another person. One thing we do is peer-to-peer learning. Peer-to-peer learning is what we are doing right now. I am speaking to a peer about something. So I'm speaking to someone directly about something, mostly to get to change their behavior and attitude toward what they believe. Other things that we do are the community outreaches, where we go to the community and advocate for changes. We mark on days like we have the GBV, 16 days of activism for GBV. So in those 16 days, we are on the streets like we are during the maandamano.
It's Tuesday.
Yeah.
Every week.
Yeah, it's Tuesday for us. So we are on the streets advocating for issues against GBV. So we also have media advocacy, which we are now amplifying with the We Speak initiative. So we're using you've seen information in the media about SRH.
Yeah.
You
it's
wouldn't.
You. But before that, it was not possible. Right now, you are even on TikTok.
Yeah.
So I've still not gotten a certain answer. At what age group, when we are packaging this sexual reproductive health, at what age group do we start or initiate the conversation of family planning?
On family planning, it's the age where someone is sexually active. One would be sexually active as early as 9 years. Another would be sexually active at 21 years. And when I'm talking about family planning, it's not about go and get this type of contraceptives. It's about even delaying the pregnancy. That is also planning your family. When you're advising a young person on, you wouldn't be able to take care of a child right now. you need to delay this time to until a specific time so that you can get pregnant. You can get pregnant so that you are financially stable. So when I'm advocating for family planning, I'm not only advocating for use of contraceptives, and also family planning has an aspect of prevention of HIV and AIDS. So when I'm asking a girl to or a young person to engage in family planning, I would be asking them to protect themselves from HIV and AIDS by using safe sex practices. So it's not only about go and get that implant on, go and get the depot. Yeah. It's on the best practices of maybe becoming a better parent in the future.
Kweli kabisa. So we should challenge our parents to stop living in fear that they want to talk to us, because they really wanted to talk to us about sexual reproductive health, but they didn't know how. And now something else is coming up, Mercy, that when a girl has no dignity because she cannot afford pads, and the pads are in Kenya, we don't have many companies that are providing or an influx of these pads. If we had sanitary towels that are all over, then we can tell the government, then we can use taxes mnaweka doza kutoka majuu ziache kuja hapa, si ndio?
Yeah.
But we are living at times when they are not enough. Whatever we have is not enough. So when we tell others don't bring, it will have an effect on us and on the economics of this country.
Sure.
Another thing, in the places that you come from, these informal settlements, people are still debating on eating and being safe, as we say, and being hygienic, because ukona chwani, utanunua unga nusu, ama utanunua pads, ama utanunua condoms, you protect yourself. Amidst all these challenges, how does this affect the economics of the country? Ama sisi peke ndo tunaumia, lakini uchumi uko affected, Mercy.
Well, to answer that, SRHR and meaningful youth engagement on this matter is very important. Sahizi, a packet of sanitary towel, the cheapest and the most maybe comfortable, is 80 bob.
80
bob.
So 50 iliisha
Kabisa.
50
labda nunue moja.
Ubai, and they're not quality. And we're also advocating for hygiene and for a girl to be comfortable when they're in this period. So in the ghetto, there's a lot of transactional sex so that their needs can be met. And that is why if we don't say the importance of these discussions, and also for the government to not impose a lot of tax on this, we're still going to have a lot of problems. For example, APHRC is a research center, and during the 2022-2023 period, they did a study that showed that in Korogosho alone, approximately 600 girls became teen moms. These are young girls from maybe 15 to 24 years that are not in a capacity to make a child maybe better, or maybe to have all the needs of this child. So we're still burdening ourselves, because the cycle of poverty keeps on repeating itself. And that is why we are advocating for safer sex. Actually, 58% of girls aged 15 to 24 are very sexually active, and these are the ones that maybe they know about contraceptives, but the rest percentage don't know how to maybe use these contraceptives, or maybe places to get them, because maybe they're expensive, and also there are a lot of myths and misconceptions that surround this information. So if the government really wants to help us, let them change this in the health centers, in the nearest facilities that there are. Let us be helped. Let these commodities be available to us. And there's a very bad misconception that is when a young person goes to
to seek these SRHR services, what we're given is advice. Yes, we need the advice, but that is not our issue. When we are coming to these facilities, we are not coming for advice. We already know that we need these contraceptives. I'm sexually active. Yeah. I want a condom. I want an implant because these are my need. This is me. So instead of the parents also very insisting on abstinence is not working, and that is why we are still having very high numbers of teen pregnancies, and not only in the informal settlements, but also in the marginalized places. These things are still there. FGM is still there. So in as much as we're saying that advice is all there, we as Jesus were saying, give us what we want.
Manze, punguza advice
bana. Najua nataka contraceptive. Okay. Najua nataka maybe pre-exposure prophylaxis. That is what I want. Usiende kufanya.
Nitakwambia sitafanya.
But
nitakupromise na niseme can die. Lakini nyuma ya
tent, like things are very different.
Yeah. Which is also risky.
It is risky, and that is why we are saying enough of the advice. We want the services, and I want also to hold the Ministry of Reproductive Health, MOH under Division of Reproductive Health. Last year, the last fiscal year, that is 2023-2024, actually there was a 1.1 billion shilling allocated to us. As a ministry, as a department. This year they allocated 1 billion. And where's this money? These people never renovate or make our youth services to be friendly. We still have issues in universities. The condom dispensers, they're always empty. And in as much as they fill them, they don't do it regularly. So we also want to hold them accountable. We want them to focus on also the informal settlements, make these people come, let them deliver the services, let them do the outreach, in as much as we as Sauti Zetu are trying to help or to also disseminate this information to young people. If a ministry is fully accountable, then as a country, we're going to reduce these things in a very large way.
Maybe an addition. I feel like, you know how political instability affects the economy at large. Like when people who are manufacturers or producers of certain items would opt to go somewhere else because it is unfavorable. So we used to have NGOs that would subsidize on the price of commodities here in Kenya. So you would get family planning at a subsidized or free service, or you would get condoms, as she had said, given out to the public, which the public feel are better than the sure condoms. So now, when it's a bit unfavorable, these prices are going to go high. We don't have anyone to subsidize the prices for us. So when you're going to access a service, you'd either forgo the service because you do not have the money, you'll either delay getting the service, or you'll have to do something else to get the money to get the service. So the government is putting us at risk by making everything unfavorable, by making the platforms, the economy very unfavorable for partners to venture in. I think we also have an issue of death, which is not mostly talked about. We do not have any data of young people who have succumbed to death because of not accessing SRH, which I feel would be now more important. We need to now occupy everywhere. We need to occupy ISO data places that have information on how many young people we lose by not accessing SRH. Kuna sahi an infection you would get yenye itakusumbua vibaya sana.
Kweli na utaenda hosi,
hakuna dawa, hakuna muuguzi, amelala kwa pale nje kwa gate na kumincha. You see, so now death is also a challenge. And then who would you tax after we die?
Yeah. Nani atatoa ushuru wote? So what I'm gathering today, my fellow Kenyans, from my fellow youths, is that Kenyan youths don't want advices anymore, because from where we sit, it's like information, we've acquired more of it. Youths hawataki akiingia hosi hata kama ni hiyo counseling una focus sana na hata si counseling, tuseme ni kuteteshwa.
Sure.
Msichana mkubwa kama wewe, have you ever seen wengine wenye they already pregnant ndo wanaenda zile prenatal clinics? Tulikuwa wapi? How do you mean ulikuwa? How is that helping me?
And then there's this issue, service providers assume you know what to do when you are in the hospital. Umeenda hapo, you are a young mother, it's your first time. Umeenda ku maybe the antenatal, then you do not know where to start. But ukilegea, mama unataka tusukumane na wewe. Unaweza enda ukienda kuangaliwa fetal mali imefika. Huyo madam hakuambii utalala position gani. They assume you know, but they do not assume that you know how to take care of yourself. Because when you're going to ask for family planning, it's more of a decision already made for you.
Yeah. You've decided.
And then they do not give you options of una feel gani ndio comfortable. Like in public hospitals, you would only get like 2 methods of family planning. Maybe the depot and the implanon. So whatever you feel is comfortable with you is not available, and they would not even look for anywhere to help you with. If you're not going to take the depot, it's your loss. So there's also that. They wanaleta commodities but not enough commodities.
Alafu wanaongezea wanakuambia abstinence also works.
Yeah. And the sad thing is that the department has money. So we wonder, where do you take all this?
So they should focus on these resources because they are there.
They're there.
We have money for these condoms.
True.
And I'm so sad that youths out there, via what Mary is saying, is that these condoms, the sure condoms, are not sure at all. So people are preferring others. But they're also even not available.
Did you see when there was a time, early last year, people were washing condoms for reuse?
Yeah.
We have sexual workers who are using the female condom with more than 2 clients. Because ukitoa hiyo utaserve hao wengine aje. You're going in the same mess that somebody else was in.
Yeah. Mind you have to protect yourself from these infectious diseases. STIs are there, HIV is there.
Masi tukijipata kwa places kama hizo, then it's evident there is no protection at all, because if I'm using this condom and I will use it on another person at juu nimeosha, there is no protection at all.
Yeah.
So nyinyi vijana saa hizi, what is your role as wacha niwaite Gen Z junior Gen Z as Gen Zs in developing this communication, offering this civic education? I understand on Twitter Sauti Zetu 254 mko hapo hivyo. What is your role as young people in helping your other young people with information that can help them? Ndio hata tukifika kwa hizi facilities, we have the guts and boldness to tell these service providers, we are here for services. We are not here you rebuke us telling us we don't know. Tuko hapa hivi tunataka services. Kama nimekuja juu ya mambo ya kama hiyo family planning na mniambie methods zenye ziko. Kama hakuna yenye iko, niambie mahali pengine nitapata. Ndio hata tukiquestion MOH tunauliza zinaenda wapi. There are so many NGOs. I think kila ghetto utasikia kuna NGO inaongelea sexual health, reproductive and rights. Lakini we still have the same problems. Masi, kazi yenu hapo hivyo ama your role ni gani katika kusaidia watu with this civic education?
As I mentioned earlier, at Community Voices, that is at Sauti Zetu Hub, we do a lot of advocacy. And when I say advocacy, sio kitu kubwa sana. Ni ati this information, we make it very available for young people. We hold TikTok lives. Watu wataingia TikTok, tutawaambia jinsi ya kuvaa vizuri condom, what are the do's, what are the don'ts. We also hold Twitter spaces. We bring expertise on these platforms. We make them talk to young people on
healthy sexual practices. And also we understand that in our community, the community that we come from, sio kila mtu atapata data za kuingia TikTok. Si kila mtu atapata sijui ako na simu smartphone ya kuingia live ama ya kwenda anywhere. So we do a lot of enrich kwa community. Tutaenda kwa community hall, tutaita young people, tutawa demonstrate how to use a condom, venye inafaa ibebwe, venye unafaa we check kama iko effective and all that.
Na venye unafaa kudispose.
Na pia venye unafaa
dispose. Ndio mwingine asichukue awashe.
Exactly. Alafu on that, on how to hold these people in power accountable. We also do advocacy training. Kama kuna place kuna training ya hizi vitu, we send our hub members there to go get education so that they can also bring it back to the young people kwa ground. So we do a lot of advocacy also. When one person is empowered, for example, umenipeleka kwa MOH maybe conference, kuna conference nimeenda, hapo nitapatana na kina nao watu wakubwa wenye hao ndo wanapata hii pesa, ndo wanakataa kutupatia. I'll go there, I'll challenge them, I'll ask questions there and make it known to them that as young people, as people from the informal settlements of Mathare, Korogosho, Kibera, this is what we want, this is what we don't have. So that training and also kufanya people from Sauti Zetu hub wakwe present in these forums and also those discussion inatusaidianga sana. And also it's not only on community voices, also other organizations, at least creating these forums, the spaces to talk about our challenges and also what we need to be done, how we should use maybe technology more on our advantage so that most young people are not falling victims of statistics. Saki next time tukikuja hapa unasikia Masi hajakuja, kwa nini hayuko sawa mentally, kwa nini? Kwa sababu maybe alikuwa victim wa SGBV and all that. So we are doing a lot as community voices under Sauti Zetu hapa to make sure that as young people we have information, and not just information, we have rightful information, kwa sababu kuna a lot of myths and misconceptions that are there, not only on contraceptives but also in HIV. Mtu ajui kama kuna pila nafaa apate ya kumprotect within 72 hours, hajui. So that is why we are here to advocate for that and also to tell young people what to do wakijipata kwa mess. Kijipata kwa ngori usijizikie, ongea, and we are here to create a safe space for them. Yeah.
Wanasema sorry.
Let me cut you short.
Sorry.
Let me cut you short.
Napenda huo moto. Usikubali point yako ipotelee. Ini art and culture man, wherever we give voices to those voices that are coming to give other voices. Ndio. So that the voiceless can feel represented. Ndio. Tuendelee na point yako ndo niliza my question.
Point yangu ilikuwa hivi. You see how now as Gen Zs we are focused on policies and the constitution so that we are able to verbalize what we want in the right way. I feel that is what we have been doing as Community Voices Network. We've been looking at policies around SRH that are favorable for us and use them to challenge the policy makers and the law enforcers on how to get the services. Did you know that in a health center there's a patient service charter?
Patient service charter. Ukiingia tu hivyo mahali unaenda ku make the first inquiry, inafaa ikue hapo na unaambiwa kwa hii service yenye unatafuta hapa you are supposed to take this amount of time.
Sure.
And this is the charge.
How you should be treated, who you should go to in case you feel you're not okay. But that information is not available to us. There are things that when you go to the facility you feel like hii ni common kukosa kukua hapa, and it should be there. There's also an aspect of when you are accessing family planning services, the healthcare worker needs to take you through the process. When they're maybe applying anything on your arm, maybe to cement the implant on, when they're maybe using the scalpel to cut you off so that they can insert the implant on, they should tell you that. When they're maybe removing the implant on also, you should be told and also be shown the implant on removed, because we have cases where a young person ameenda kutolewa implant on moja imebaki ndani but hakuambiwa yale ambayo tu imetoka hakuonyeshwa ni gani. We have issues when you're going for maybe the cervical cancer screening. Doctor anaweza not doctor as such, but the service healthcare worker anaweza kufanyia something that is not in the medical procedure because they are not informing you. Unaona tu kiinsatiwa vitu, but nobody is taking you through the process. So as young people, we need to know our rights when we are going to the healthcare worker, how I should be treated, how I should be informed before any service and after the services, and what I should be referred to do next. Unaweza enda umefanywa service but hujambo ukienda unafaa uoge after hapa. Hakuna hiyo limited information yenye tunapewa. So when we are focusing on policies and documents, we find that kuna underlying issues zimelala hapo zenye zinaweza to support zenye hatuko aware of. Na ziko hapo. Kuna zenye pia tunafaa kubadilisha, zimekuwa zinatukula ndani, but since we do not read, maybe we do not look at the policies in depth, hatuzioni, so zinaendelea kukua, hizo ndo zinatufunga in our advocacy journey.
Ukweli. Masi, if you no, I won't use if you've been there.
Yeah.
You've seen the protests that have been there.
Sure.
You've seen the Gen Z's moving conversations globally. The whole world now knows about the group of youth in Kenya, the Gen Zs and the millennials, and the things they are doing. What lessons from these protests that started maybe with Reject Finance Bill, right now they are occupying everywhere, occupy MOH because it's not working, and occupy this other ministry because it's not working. As you plan to occupy, what lessons have you learned from those protests that now mnaziongeza kama venye Mary anasema mnaziongeza katika community services hapo hivyo kwa Sauti Zetu hub? What other lessons mmepitia na mnatusaidiaje nazo?
Well, something I've really learned from the ongoing protest is that we as youths, sisi kama Gen Z, we really have power and we are very important and our voices matter. It is so sad that before we are told that young people, we need you at the table, kujeni tuongee, but actually whatever that we talk is only taken for granted. Like it's never something serious. So I'm actually so happy that whatever that you're fighting for in a later results.
Okay.
Someone told me that if you're not at the table, you're probably at the menu. You'll be eaten in that menu kwa sababu there's a lot of tokenism if you're not rightfully engaged. And this is something that you're fighting. We just don't want kukua at the table and be eaten as the menu. We want results. And something I love about us Gen Z is that we're occupying everything. Every unfunctional thing that is not working according to how it's supposed to work. I love how as Gen Zs we are empowered, and also we are helping each other to know what the constitution says. We have lawyers that have come out now. They're telling us this is what it is written. It is not supposed to be like this. Watu wanatufinyilia. We should stop this, and we are actually doing it. So that power on voice that we have, and we're actually using it the right way, will help us. And something I'm saying is that the Gen Z movement is not just a wave. Let us not make it as a wave. Wave itakuja iishe. Itaisha tu, lakini kulikuwa na reject finance bill. Ilienda sasa
si wave bado iko.
Wave iko.
Si walitupa wakadhani imeenda.
Yeah.
The CSS wakaenda. Na bado wave iko.
Wave iko, and we're here to stay.
Of police. Na bado iko. Watu wamelala pale hivyo nje ya MOH wakitafuta kazi. Si hata saizi yanaitwaje? CS na kumencha hata yanatafuta kazi.
Yeah, yuko.
But the wave is gone. But we are still there. The movement is still there. What's the future like? Now that we are giving these people civic education, they know. Sasa, hata mambo ya sexual reproductive health and rights, they know all these rights. What's the future like in the next 5 years for the Kenyans, especially the youth?
Before I get to what the future would be like, I'd like to add something that has come up during the protest is the aspect of resilience. Allow me to go to church kidogo. So in the Bible we have a story.
Occupy church.
So in the Bible we have a story where kulikuwa na mtu alikuwa na mgeni, alikuja saa 6 ya usiku, but the person did not have food, so he went to the neighbor and kept knocking, asking for food. So the neighbor was like, I'm asleep, I cannot give you food right now, ni saa 6 ya usiku bana. That person was like, no, nataka tu chakula, nifungulie, and he kept knocking and knocking and knocking. And then the Bible asks there, why do you think that person eventually gave the person food? Was it because he felt sorry for the person? No, it was not because he felt sorry. It's because the person kept knocking.
Persistent. Jamaa, okay, I don't care kama ako na njaa, but atashinda akinifungua.
Nitalala saa ngapi?
Nangoja. Wameshinda ama kitambo kwa Bible wako wanaambiwa your dreams.
Ni kama on the same. Ni kama venye tunashindana tukiambiwa your dreams are valid. Your dreams are valid, but actually they're not valid. Tukienda kwa utafuta makazi already kuna kama una connection kitu wezi pata. There's a lot of corruption that we need to fight. Alafu mention story ya Bible nikakumbuka this time Jacob alikuwa na wrestle with the angel until akwe blessed. And this is what we want as young people. Tumeona maperoto akiteseka. Tumelala njaa. Lakini hawa watu ni kama okay, wao wako in power, they have money, they have influence, hawezi feel. But mimi Mkenya normal, mi jinsi mdogo mwenye saizi hiyo fee ikipanda nita drop out, it will be so bad on me. My dreams will be cut short. And this is not what we want. This is not what we want. We want change, and we are not stopping until we get what we want.
It's our future.
It's our future.
Revolution. But then kuna pia hii aspect may come out where we are challenging leaders that are overaged, ama out of age, ama should not be in the working age, out of power, because now they're making decisions for us based on what they lived through. Sai hatutembei kutoka hapa 30 kilometers to school, so I would not expect the same story. Mtu akiwa kwa budget for something anatumia what happened to them in the past. We are in the now, so I'm feeling like challenging those leaders from those spaces. Mnapata mtu ana represent young people wako 40 years, you're like
acha nikupe example. Kwa public domain na mtu anaweza tuambia kitu. There was a time Mudi Awori was appointed to represent the youth.
Imagine.
Na saa hizo sisi the youth, we are expecting that we are making our futures. Wazazi wetu imagine wanatutegemea. They've gone through so much hadi kuambia Kibaki wewe tunakuweka hapo hivyo ndio watoto wetu wasome. Wasome wafanye nini? Watusaidie. But again unakuja because education is the key. Umengangana. Wewe si bado uko shule?
Niko shule.
Uko shule KU. Unamaliza unapata manzia kuna hizo jobs. Wanakuambia sasa jua kuna jobs, jitengenezeni ma jobs. Na inakuwa ngumu sana.
Sasa unaambiwa kuna TVET fulani iko kwa mtaa. Alafu pesa hizo unaambiwa kuna ICT hub inakuja. I've been there, like nimesoma for example IT. What do you want me to go still do in the IT hub that is near my place? Like we're still not addressing the real thing. Ni kama nakuuliza swali moja alafu unanizungusha sana before niambie. Yet we have tuko na power, like we have the resources. Shida ni venye inakuwa managed.
And then pia tumeweza kuchallenge aspects of nepotism. Because now tunaona youth champion wetu ni mtu wako very privileged. I bet she has never missed food. Anajua kulala in good places. Na huyo ndo mtu ana advocate for young people also in the informal settlement. So it does not even make sense. Because that person does not know how it feels like to be in that situation.
We represent ourselves.
Sure.
We should represent ourselves.
And it will work, right?
Yeah.
Great.
So what it looks like. What it looks like in 5 years, I feel. Sasa ndio comparison yetu na tulikuwa tunakuwa compared na Spain. Singapore. Ndio itakuwa sasa hapo. We are right now maybe tuseme tuna Kenya is under reconstruction, renovations, so I feel like in 5 years we will be able to access services without stigma and discrimination. We would have reduced cases of teenage pregnancy. We'll also be able to have no or zero mother-to-child transmission of HIV and AIDS. We'll also be able to uphold self-care in matters of adherence to HIV medication and mental health, I feel we'll be more mentally stable, and mental wellness will be upholded, and I feel we'll also be able to occupy the spaces and make the necessary changes.
And change. Kama watu wanafeel hao uguzi wakienda wanawapa hizo rebukes, it's upon you. Mkishasoma mwingie hizo spaces, watu waogope, watu waache kuogopa kukuwa nurses. Tuingie kwa hizo spaces zote. Watu wakikuja, kama umepata Masi we Mary ndio amekuja hapo hivyo, au utamuongelesha nini juu unamuelewa. Na sasa mtoto wa Masi itakuwaje? Si itakuwa better juu unamuelewa. Umekuwa ukielewa mama yake. Unajua wengine wenye ni wazee, maybe they never had a chance to talk about what you are talking about. So wao vitu zenye walikuwa wanazisoma raw. Ndio maana ilikuwa inakaa tabuish wakituelezea. Lakini sisi wenyewe tunaweza. Alafu tunapata ni generation yenye pia imechoka. Wamengangana manze. Ushisikia stories za kumake it ushafika mpaka 50 sasa
you're not going to be.
Hadi washaanza kuconcentrate sasa na watoto wangu. Kila mtu anashughulika na watoto wangu wasome, wanisaidie. And let me tell you guys that sisi pekee tunafurahi juu ya conversation yenye tuna have saizi and how it is shaping this country in the next 5 years. I can see online Kenyans are active there. Kalisto Nyagwa on YouTube anasema very insightful. Kuna mwingine anaitwa creator anasema nice show Ojwang the man. Huyo ajiongelea kuhusu nini, but anasema it's a nice show because our young people are learning. Our young people are having a conversations themselves. Did you know that KUTV is a product of Kenyatta University, who are the greatest consumers? They are the youth, the millennials and the Gen Zs. Hao ndo our greatest audience. So tukiongea vitu zenye sisi zinatuhusu, then we are changing this country for the better. Ama namna gani?
Kabisa.
Haya, kuna mwenye aitwa Olerinke TV anasema watching live from Kitengela. Do you know what his comment is hapo mbele? Educative. That you girls have done us proud. You've done. Mara mingi haya mambo hatayaongelea na ladies sana. Tumetoka kwa hiyo nini ya inequality. I'm sure in the next 10 years we'll not be talking about 2/3 anywhere, because the 2/3 gender role ilikuwa inakuja juu ya wanawake kufeel wameachwa nje sana kwa hizi spaces, si ndio? Na saizi wako hapo, wao ndo wanazicontrol. We have Vilda Atieno anasema our voices matters. Nice show. Ameongeza mnafeel aje is it a nice show?
It is. I'm loving it.
Kabisa. We have Jilo Mamu all the way from Kahawa Wendani. Huyu Jilo anakuaga DJ na ni dem. Anasema sexual education empowers us with knowledge to make informed decisions and understand consent. By the time tujongia kuhusu consent. Na vile huko kwa ground watu hawapewi consent.
True.
Sex has become so transactional that you don't focus more on consent, you focus on the coins that he will send. Hiyo ni mbaya, si ndio? I'm glad to see young people, anaongeza anasema I'm glad to see young people advocating for this important issue. This is very informative. Talk to us about Sauti, Zetu and community voices. Nyinyi wenyewe mahali mnapatikana. If people want to join that hub ya Sauti Zetu, how do they join? Wote tupe, alafu Masi atatuambia mnapatikana wapi.
If you want to join Sauti Zetu, you can do it through the media. Follow us on Twitter at Sauti Zetu 250. You can also reach our executive director Rita Nindo or our programs manager Martha Kombe for more information. You can also come to Kariobangi, Landmark Plaza, and ask for Community Voices Network.
There are a lot of mothers doing this in this country. We have Mother Kome in the Supreme Court, and we have Mother Kombe.
Yeah.
Pale hivyo kwa
Community Voices Network.
Kabisa. So how ambao wanakuja online, where are you found on TikTok, Facebook, Instagram, and Twitter before Twitter?
Well, our handles are the same as she mentioned. It is Twitter at Sauti Zetu 254. Then the rest of the platforms, you can find us at Community Voices Network. Yeah.
Amna roles huko. Manzi nasikia ni kama madirector, alafu ndio nasikia kuna director mahali, kuna programs manager mahali.
Tumekuwa empowered.
Na hiyo ndio tunafaa basi kuangalia everyone akuwe empowered so that tuachake hiyo story ya misrepresentation.
Maybe to mention, we would like to give our appreciation to ICRHK, International Center of Reproductive Health Kenya, and USAID Momentum for making this possible. Would also like to appreciate PP Globe, Planned Parenthood Global, and Bill Now because they are our donors, and also APHRC for the data and information, and Girl Effect.
Girl power. Nasikia ni kama kuna a lot of donors pale hivyo. Does that mean that naitisha pia partners wengine, people who can come and they want to support you, Masi? How can they help in ensuring that these voices you're giving to this community are amplified by maybe doing some sponsorship, ukonje, sponsoring those trainings that you have in the community halls and all that?
As I mentioned earlier, Community Voices has been there, but now legally it has been there for the past 1 year. So we're just we're a startup organization. We are growing, and we'll be very happy if we get partners also, and also donors to come and support the beautiful work that we do in Korogosho and also in other informal settlements. So we are very open to partnership, and also we are very open to welcoming people from other places to help us in what to do, and also to help each other. In this world of organizations, the CBOs and the NGOs, you can only thrive through partnership. And that is why we are very open, and that is why she mentioned a lot of organizations that has made this possible. So we are very open. You can reach us through the platforms that we've said, and we are very open to collaborate.
Ndio nikienda kwako niende nikimaliza. Sasa wewe tuambie mahali wewe Masi anapatikana, ndio tuende kwa Miriam. Nasikia venye Miriam amewaka na akimaliza kuwaka hivyo basi hata yeye atuambie mahali tunampata, because there are some people like university students, they may want to reach you out, guys, ndio hata mwasaidia vile wataingia huko. Some of them are knowledgeable like you, and they would like to add an impact on that. True. So wewe wanaweza kupata wapi, alafu ndio nimalizie na Marias tunamaliza show.
Nikisema mahali watanipata, there's something that came to mind that mwaka imepita during maybe January up to now, before the Occupy Everything, I was reflecting at the Vision 2030, and I was so sad that we might as a country maybe not be able to achieve what we had set, but with the ongoing revolution and what we are doing in this space, I'm actually happy and I'm hopeful that we are going to obtain a success in our Vision 2030. Then where you can find me on all my social media platform, as Twitter, I'm Mugecha Masi, or Masi Mugecha, at Mugecha_Masi, IG Masi_Mugecha, Facebook Masi Mugecha.
Yeah, kabisa. That is Masi Mugecha, ladies and gentlemen. Mtampata hapo with all that vibrance. Now, if that vibrance imekuwa kwako ni mstaajabu ya Musa, acha tusikie ya Firauni sasa.
Okay, so before I also mention my socials, I would like to sell out the We Speak initiative, where I am the project lead. So We Speak initiative is, as I said, focuses mostly on how we can use media advocacy to amplify matters SRH. So we send our young people to TV station, radio stations, we write articles, we engage in TikTok and Twitter platforms to amplify sexual and reproductive health messages. So I would like to call out to any donor or any partner who is enthusiastic about sexual and reproductive health and would like to engage with young people to come to Community Voices or reach out through our socials so that we can make We Speak a great initiative in 2024 and the years to come. So you would find me in Twitter at I am Maria_KE.
Oh, you are Maria? I am Toto Miriam.
On TikTok at I am Maria also _KE1 and on Facebook as Maria Maria
mbili.
No, Ma alafu Ria.
Oh, Ma
Ria.
That's
and also I feel like I would, before we close this, I would like to appreciate maybe Madam Melanie Akoth from ICRH, who was our facilitator for the media advocacy project that has led to this initiative and this platform right here, and our ED Ritanindo and Martha Kombe. It wouldn't be possible without them, and Sauti Zetu have members for giving us the power and seeing us through all this.
Ukweli. That has been big. Na Sauti Zetu Hub, they are asking if you are donors out there, wamefungua door na unaweza kuja hata wewe usaidie. The more the merrier, si ndio? Haya, I do this feedback ndio sasa niweze kufunga show officially. Kuna watu bado wanauliza, je, kuna usanii leo? Na now that is art and culture. We have Rita Anindo herself, and she's watching you and she's saying powerful. Mercy and Mary, you are a powerhouse. Power. To the Gen Z.
Power.
Hiyo ameongeza live on YouTube. I'm also seeing Lucy Namu anasema so encouraging. There is a need for youth engagement because our voices matter. Youth empowerment matters because all these wazee wakienda na tuharibu nchi, tutaanza zero. Vision 2030, I'm happy that ilianza kitambo, but around 6 years zenye zimebaki ndio tuna realize 2030 inafika, and it is so fortunate that sisi ndio tutafikisha hizo vitu zenye walikuwa wametupangia. Ni ukweli wazee uona mbele, lakini wacheni sisi tuende mbele pia.
Kabisa.
Naam, penzi mtazamaji, nimekuwa hapo hivyo na Mercy na vile vile Mary. Tumezungumzia mengi kuhusu sexual reproductive health and rights. Hawa kina dada wanatoka community voices pale katika Sauti Zetu Hub. Hiyo ni hub ambayo iko under community voices, right? Kabisa. Na unaweza kupatana na wao kama uko Twitter ukitumia Sauti Zetu 254, alafu utawapata tena zaidi na itakuwa shwari. Mimi napanga kumalizia kipindi hiki ama kitengo hiki hapa kwa sababu we still have another lounge ambayo tutakuwa tukizungumzia kuhusu masuala ya sanaa. Sanaa ya leo tunaongelea kuhusu michezo ya kuigiza, plays. They have a play that is called Guns and Roses. They are Son of Man Theatre who will be coming right after the break. Ngore, tuingie hapo madukani kidogo ndio hata mimi nipigwe picha na hawa rembo. We continue providing that civic education huko online. In the meantime, stay tuned.